Hi, I'm Shannon Gonter with Therapy by Shannon and Mental Health Louisville. And we are here for our Ask Us Anything series. These are questions that are asked by you guys. We take them in, find a professional that specializes in that area, and get them answered for you. So today we have Keri Knight with us. She's a licensed therapist here in Kentucky. She specializes in helping people with ADHD and anxiety. Helping them overcome obstacles so they can reach their full potential and create the life that they love. She has a special interest in working with women and girls who have ADHD, as well as those who are creative and sensitive and gifted in all different types of ways. Keri also specializes and has lots of experience in working with individuals with trauma and in stress management techniques. And she takes a very holistic approach with all of her clients and blends a handful of different therapy modalities with a mind-body wellness approach, and is a very big, strong advocate for incorporating mindfulness practices into her daily life as well as her clients' daily life. She is qualified in EMDR and is a mindfulness teacher and will complete her yoga teacher certification this year. That's really cool. And she sees online counseling clients throughout the state of Kentucky and then does in-person sessions with those who are local to Louisville. If you want to follow her on Instagram or Facebook, you can just do that. And it's at Keri Knight Counseling, and that's KeriKnight Counseling. But thanks for being with us, Keri.
Thanks for having me.
So we've got lots of questions for you today. It just seems like they all came rolling in at the same time. So we're not going to ask all the questions right now. Usually I introduce the questions and just kind of hand it over to you. But since we have a handful of them, the topic of what we're going to be talking about is ADHD. So of course we thought you were the perfect person to answer our questions.
I love talking about ADHD. So
yeah. So I'll just kind of start from the top and then we'll work our way down and just kind of knock out a handful of these questions that rolled in. So one of the main ones that came in, and we honestly see this one come in quite often, is like, what are the signs and symptoms of ADHD? This question that came in was more specifically for adult women. So kind of like, what are the signs and symptoms for adult women that are diagnosed? Or maybe thinking of the diagnosis of ADHD. Yeah.
So, most of the of what's written about ADHD and the diagnostic criteria is for little boys. So, research, there hasn't been a ton of research on women with ADHD, a little more recently, but not enough. So it can look different in women than it does in kids or in men. So it's a great question. There's the typical, what we know about ADHD. There might be some hyperactivity, some inattentiveness, some problems with focus and concentration. You're going to see problems with organization and maybe time management, running late, or they might be messy, have a messy car or a messy desk, difficulty keeping up with, household chores on a consistent basis. Some struggle at work. It might show up in relationships, but, you definitely are going to see just kind of the classic inattention. It's going to be hard to focus and concentrate. I touched on hyperactivity. There's a lot of times people are like, well, I don't have the H. I don't have hyperactivity. I just have ADD. It's all the same thing. And the way hyperactivity shows up for some people is a hyperactive mind. Or maybe even like hyperverbal, so hyperverbalization. So they're talking a lot. One of my daughters has ADHD, and she had a comment on her report card when she was younger that she's very social. So hyperactivity can other ways than just bouncing off the wall or being really physically active. So Ned Hallowell, he's an ADHD expert and has written a bunch of books, says that the ADHD mind is a Ferrari brain, but with bicycle brakes. So it's just your mind goes really fast. You have thoughts a minute. So there are other signs and traits as well that you might not know about, kind of some soft traits like you're going to see, so you might not see this on the outside, but if you are a woman with ADHD, you're going to experience a lot of shame, like feeling like there's something wrong with you, some guilt, a lot of blame, a lot of self-blame. Let's see what else. They're feeling like you're not reaching your potential, like you have all these possibilities and all this potential in front of you, but you're just not reaching it. And that can do a lot of harm to self-esteem and how you feel about yourself and
Sure.
your confidence and what you think you're capable of. So, and it shows up different for women because in our culture, there are different expectations of women than there are of men. You know, women are expected to maintain relationships and send the birthday cards and, you know, make sure you're keeping up with your friends and, you know, your family and holding everything together and keeping up with the house while you work and, you know, take care of the kids and manage all that. And that is a large load on your executive function skills. And it's difficult for
Mhm.
women with ADHD. So there's a lot
Yeah.
of shame here.
Oh yeah, for sure. And you already touched a little bit on this, but kind of like how they differ from signs and symptoms of males with ADHD. And a lot of that, yeah, like is like the socialization, I think, of
Yeah.
how we're supposed to be as a female, but also like the research that you said, like a lot of the research is on probably boys under the age of 10. Um, so that doesn't quite fit the bill for adult women or even adult men, honestly.
Right. Or even, I mean, young girls who, you know, they fly under the radar because they're not causing problems in class. They
Sure.
might be inattentive daydreamers, and so they're not causing problems. You know, women or girls are socialized to be nice and kind and to, you know, think about other people. And so you don't want to make this big, you don't want to be the disruptive one in class, you know. So women oftentimes later diagnosis, which is, you know, you want to catch this early
Mhm.
so that you can treat it. You know, a lot of times women don't get diagnosed until their daughter does or their child does, and they see similar traits. Or when the load gets to be too much. So, you know, they start a family, or when they go off to college, or sometimes it's even, you know, in middle school. You know, like that's when it starts showing up. Hopefully, you catch it then. But women get later diagnoses. So,
Yeah.
um, yeah, that's another issue too.
Yeah. And I would imagine, if I'm an adult woman who's noticing these things, I can probably look back into my high school adolescent years and be like, oh, okay, some of this is making sense as to why school is really difficult or relationships or whatever it may be. Uh,
Yeah,
yeah.
yeah. And you know, a lot of times people with ADHD are bright, and they figured out how to compensate, and so they might not have had problems in school. You
Mm,
know, and so everybody's like, you don't have ADHD, you're smart, or you make good grades, and that's
mm,
just not the case. It really shows up in other ways
yeah.
than just school. So
Yeah. Yeah. It really has been labeled like a school behavior diagnosis, which is quite unfortunate since
mhm.
it shows up obviously everywhere with us and throughout
Yeah,
our lives.
yeah, it does.
So if you are recognizing some of this stuff inside of yourself or maybe in like an aunt or a sister or a kid or something like that, I guess like what do you do or like what are the resources or like I know like a lot of people talk about like getting tested for ADHD. Like could you just talk a little bit about some of that?
Sure. Yeah. So there is no single test that's going to show that you have it. You want to go to somebody, a qualified mental health practitioner. So whether that's a therapist, doctor, a psychologist, somebody who is experienced with ADHD, somebody who really knows about it and really gets it and can pick up on the subtleties of it because it's pretty complex. Um, I mean, you could have a room full of people with ADHD and everybody would have similarities, but everybody would have differences as well. So you really have to know what it is and what it isn't. So you know how it's showing up. So anyway, um, you can go to a doctor, you can go to a therapist, like I said, a psychologist testing, and sometimes that's helpful. Psychologists might me on this, but sometimes the testing isn't as helpful for adults. as it is for kids, but it does help you. It gives you some data. It
Mhm.
does help you rule out other things because ADHD can look like a lot of different things. You know, there's oftentimes, I forget the statistic, but more commonly than not, there is some other condition that you're dealing with. So whether it's a learning difference, you know, dyslexia or some processing disorder, or maybe depression, anxiety is always there for the
Mhm.
most part. Trauma can look like ADHD. Lack of sleep can sometimes look like ADHD. So you're going to go to somebody who knows about it. They are going to take your history. So over time, like what was it like when you were a kid? What's it like now? You know, it's genetic. So do you think your parents had it? Do you think anybody else in your family had it? Do your kids have it? Um, so they're going to take a history. You might do some surveys and questionnaires. They should talk to someone in your family or someone that's close to you to get collateral history, because sometimes, you know, we have some blind spots for ourselves, and
Mhm.
you know, so other people might be able to see things that you can't.
Mhm.
Um, so yeah, you just want to find somebody in your area that can point you in the right direction. And a lot of times what I'll do is, even if they don't want to start, people don't want to start therapy, let's say, or necessarily see a therapist on a regular basis, I'll meet with them and we kind of come up with a plan together and at least kind of tease out some of the differences, you know, like, is this anxiety? Do you have a trauma history? You know, what was school like for you? And
Yeah.
then I can at least point them in the right direction. So
Yeah. Yeah, that's got to be really helpful because, yeah, for whatever reason, like a lot of the times, counseling or therapy is not going to be something that's immediately going to be accessible to us or on our radar, financially, schedule wise, whatever it is. So to have kind of other options to meet people where they're at. Do you have any like, I don't know, whether it's like books or online resources or anything, like if people, I don't know, maybe we can even like plug those into the comments or something like that.
sure. Yeah, I'd be happy to yeah, give you some to plug into the comments, or if anybody wants to email me, I'm happy to email them resources. But yeah, I would say start, there's so much now. Start with CHADD, CHADD. That's a great resource. Um, the adult, let's see, what is it? Attention Deficit Disorder Association. So ADDA. I think it's
Okay.
ADD.org. That's a great resource for adults. Attitude Magazine, ADDITUDE.
Mhm.
So those are great online resources. There's some good books. You Mean I'm Not Lazy, Crazy, or Stupid is a good one. Any of Ned Hallowell's books are good. The Gift of ADHD, I really like that a lot. And I hope that we touch on that. I hope I don't forget, because um, when you were asking about the signs and symptoms of ADHD, there
Mhm.
also are a lot of strengths that come with having ADHD that people who don't have it might not necessarily have. So
Mhm.
we're going to see, you know, there's tons of creativity, out of the box thinking, and innovative thinking. Um, they're fun loving, really generous, big hearts, a lot of empathy, a lot of compassion. Um, you know, risk takers, which can be very helpful if you're, you know, an entrepreneur, or and they're often entrepreneurs. So there are
Mhm.
a lot of positives about ADHD too. So I wanted to make sure I got that in. Back to
Mhm.
the resources. Let's see what else. I would start there. There are tons of podcasts now. Um, a lot of people are telling me recently, especially younger people, but more and more not so younger people, that they're getting information on TikTok,
Mhm.
social media. So just, you know, make sure that it's a credible source, and um, you know, it has its positives, but make sure that it's a credible source.
Yeah.
And again, if anybody wants to email me, I'm happy to give more resources.
Yeah. Well, and I'm so glad you brought up the strengths on, I mean, I feel like most of the time, especially when we're talking about anxiety or depression or whatever diagnosis it may be, we're so focused on the symptoms that like add chaos to our lives, where we're not like, oh, there's always another side of the coin. There's always
Right.
something that is like helpful and unhelpful about this. And like, how do we learn more about both sides, honestly, to be able to just know what's going on And like that, this really is something that, you know, does add a lot of strengths and add a lot of things to our lives that are helpful. Like it's not all like this bad thing. But I think a lot of times, well, unfortunately, a lot of things in our field get that stigma or get that attached to it.
I know, unfortunately, that's true. And it keeps people, I think, from getting a diagnosis or at least trying to understand it more, because it just feels so negative. And people with ADHD have grown up with so many negative messages. I say it's like a billion little paper cuts. It's like a trauma in and of itself because you grow up feeling like you're different. What's wrong with me? Why can't I get it together? I feel like I'm smart or I have these talents or whatever, but you compare yourself to other people and it's like, why can't I make this work or why can't I make this happen for myself? And so you feel bad about yourself. So then you read the diagnostic criteria and it's like, oh, well, it just feels so negative.
Yeah.
So.
Yeah. And then I think we've kind of touched on like a lot of the questions except for, like how can like friends or family or kind of like people on the outside support a loved one who is wherever on the journey of, being diagnosed or in therapy or, whatever it is, just like, what are some things that like friends and family can do to support someone?
Yeah, that's a great question. It's important to have family support or, loved one support. Well, first I would say, make sure if you have ADHD, make sure that you are getting your own support wherever, anywhere and everywhere. Make sure that you're talking to people or at least like maybe on, their Facebook groups or online forums or something, listening to other people or reading about other people who have ADHD to help reduce some of that shame and to so that you know that you're not alone.
Yeah.
And educate yourself about ADHD so that you know what it is and what it isn't and how it's showing up in your life. So that's first. Second, know that you deserve support. I often hear that it's minimized by parents or loved ones, or people will say, well, you're using that as an excuse. So, understand that most people are either uneducated, just don't have the information, or, maybe believe, they're misguided. They don't have the accurate information about ADHD. So you might need to be patient, just like they need to be patient with you. And if you continue to try to ask for the support that you need and they're not able to give it, you might need to go to somebody who can offer you the support that you need. But if you do have a willing participant, a willing loved one, then I would just say, maybe offer little tidbits of information about ADHD here and there from a neutral place. You don't have to do a PowerPoint or pull out your slides and, educate them on it. But, over time, maybe just kind of throw in a little bits here and there and, watch your language, rather than saying, oh, it's because I have ADHD. Maybe just say, well, that's just how my brain works. Can you help me to remember this because I'm going to forget because that's just how my brain works, or I have to write everything down and that's okay because that's how my brain works. I also would say, figure out what kind of support you need. Do they need to just listen and not offer advice? Do you need to ask them to not try to parent you? There might be some communication issues, so you guys might need to see a therapist together to work through those. So just figure out what you need and then ask for it. And if you need support, I would say reach out to a therapist to help you get the support that you need, because it's an important piece of treatment.
Yeah, definitely. I think, from both sides of like kind of approaching it as like an explorer or like with a bit of curiosity opposed to like, yes, like I'm here with my PowerPoints to teach you about these things. And or on the other side being like, I'm here to make sure you do your to-do list and like, kind of parent you in a sense. So like either way, I feel like it is very easy to get almost like unknowingly trapped in some of those patterns because we're like, oh, we're helping. And it's like, yes, but we're also creating some other dynamics that cannot be so helpful.
Yeah, definitely.
Yeah. Well, great. And one thing that, well, this wasn't a question, but this is kind of something that popped up in my head when you were talking. I feel like a lot of the times, and maybe this is, I don't know where it kind of comes from, but I feel like a lot of times with ADHD, people are like, I just want to go to my PCP and I just want to get whatever type of medication or, whatever it is. Like, I feel like it is one of the diagnoses that is like, oh, I'll just take a pill for that or whatever it may be.
Mhm.
I don't know, like that's just something that kind of popped up in my head on the end of like that. I mean, for most things, it's like, oh, that'd be great. That'd be really nice. Just take a pill and be like, cool, we don't ever have to explore anything.
Yeah.
But I don't know, how does that kind of show up even, yeah, maybe just in the clients that you work with or just kind of in the overall space of where medication fits into ADHD?
That's great. I'm so glad you brought that up, Shannon. So medication is, if you can find the right one, is very, very effective for ADHD. I think I've heard it helps, maybe 60% of, so people take the medication and they have such relief. I mean, it can be life changing for people.
Mhm.
But what happens is, there's a honeymoon period, and then it's, people start to say, I don't know if my medicine's working, or I don't know if it works anymore. Maybe I need to increase the dosage. But really, probably what needs to happen is you might need to find a coach or a therapist who specializes in ADHD to help you work through, to help you learn skills. Pills don't teach skills.
Yeah.
It's something you'll hear a lot in ADHD treatment. So you need to learn the strategies and tools and skills to manage these challenges that come with ADHD, because you just weren't taught how to do these things in a way that works for your brain and your unique wiring.
Mhm.
If a neurotypical person is like, well, just go do it, just use a planner.
Mhm.
It's like, someone with ADHD is going to say, I have zero where to start. I mean, that's completely overwhelming to me. So you need to go to somebody who can kind of walk you through those steps. Or, it's similar to sending a kid into the room, a kid with ADHD, like, go clean your room. No idea where to start. And you have to break it down and, um, break it down into smaller steps and prioritize where to start. So, medication plays an important role if you can find the right one. I always like to say, if you think of ADHD treatment as a table or desk with four legs, one leg is medication, and I would even add in anything like body oriented or physical. So exercise is a great tool to manage ADHD and anxiety. Well, I mean, a lot of things, we know that.
Mhm.
But meditation, I mean, that rewires your brain. It changes your brain, and it can help a ton. So there are other things besides medication. There's nutrition, there's supplements. Talk to your doctor about all of that. And then the would be education. You have to educate yourself about ADHD. Like I said earlier, it's really complex, and you just need to know what it is and what it isn't, so you know how it's showing up for you and you understand your own brand of ADHD. And then the other two legs would be counseling or therapy, and then coaching. So I
Mhm.
just talked about what coaching does, helps you learn the skills and strategies to help you manage those executive function challenges. But then therapy is an important piece too, because there is that shame that, adults that come see me, that, they've grown up thinking there's something wrong with me. Um, there are often communication issues in relationships and problems in relationships, and some secondary anxiety that's affecting their mood. So therapy can play an important role too. There's a lot of perfectionism and people pleasing with ADHD.
Mhm.
So therapy is really helpful. And that's the part that I think people don't know. People are like,
Mhm.
I go to their doctor and they say, okay, I've got the medicine.
Mhm.
So
Yeah.
yeah.
I like that visualization of like, well, that is one component and it does have um obviously have its space there. Like we like the four we prefer a table with four legs than three.
Right.
But
Right.
like, well, what about the other ones? They also have their space there too.
Yeah, definitely.
Yeah. Oh, cool. Thank you so much. This was all good information. Is there anything else? I mean, I've covered the questions and I think we've even covered more. But I don't know, anything to kind of leave the audience with, whether it's just
Um,
mental health in general or anything?
I would say, the one point I really wanted to drive home was, I mean, all of this was good. The questions were excellent, but there are a lot of strengths that come with having ADHD. So
Mhm.
if you have ADHD, then, you know, find a way to recognize that in yourself. And if you can find the support that you need to help you minimize those challenges so that you can use your strengths in your life and you feel like you're reaching your potential. And it's possible. I mean, there are a lot of very, very successful, smart, talented people with ADHD. So I hope that people can get the help that they need and the support that they need. And
Yeah.
if anybody has questions, in addition, that we didn't touch today, or just, need me to elaborate on something, I'm happy to answer those. If they want to email me, my email is Keri, Keri, at KeriKnightCounseling.com.
Perfect. Yeah. Yeah. And I just love that. I mean, I think the strength-based approach is not quite preached enough as much as like I'd like it to be, but it's really like true across everything that like, I mean, especially like in the therapy world, there's so much we come in being like, well, I want to stop being anxious or I want to stop being distracted, where it's like, it's not really about like, I mean, yes, sometimes our behaviors do change after counseling, but it's not really about that. Like, it's really about being able to understand why we are the way we are, meet ourselves where we're at, accept ourselves where we're at, and then see what happens from there, opposed to being like, I'm going to come in and change all of this stuff, even before I even understand it or know why it's there.
Right. Right. Yeah. I love that. Yeah. Totally.
Yeah, we'll get there as a field, but yes,
Yeah.
little by little.
That's right.
Well, thank you so much. And everyone listening, remember, if you have questions, mental health or wellness related, whatever it may be, we'll find a professional to get your questions answered. So just DM us and we will do that for you. And remember, on Instagram or Facebook, you can follow Keri at Keri Knight Counseling, or shoot her an email over at Keri at KeriKnightCounseling.com, right? Okay.
Yep.
But yeah, well, thank you so much.
Thank you.
Have a good day.
Thanks. You too.